Statements made by the hosts and guests of this show do not necessarily reflect the views, the opinions, the policies, or practices of Genesis Radio Network or any of its sponsors. Thank you for listening to GenesisRadio.com.
We on a sister ship. Come with us, we on a sister ship. Yeah, we on a sister ship. Roll with us, we on a sister ship.
Sister ship, we got this now. Come on, let's talk about it. Sister ship, we got this now. Come on, let's talk about it. Sister ship, we got this now. Come on, let's talk about it. Sister ship, we got this now. Come on, let's talk about it.
We're my sisters, we got this, sisters. You roll with me and I'll roll with ya. We're my sisters, we got this, sisters. You roll with me and I'll roll with ya.
Substance, sis, you know we on a mission, no games. Help each other get over some things. Real strength, bring change. Cause we been through the rain. Now it's time to shine like blank. Let's talk about life skills. We building up our quality to right wills. We rolling out of poverty, love heals. So we become the prodigy of how a sistership could be a really hot commodity. Stand together, we unite and hold hands. Support each other dreams and our plans, doing everything we can. Just to show we understand the power of a friendship fam. Live life on purpose. Together we learn it. Yeah, let's talk. We don't wanna see you hurt, and we here for each other. No matter the color, networking. That's for sure and for certain. Yeah, we on a sister ship. Come with us, we on a sister ship. We on a sister ship. Roll with us, we on a sister ship.
We're my sisters, we got this, sisters. You roll with me and I'll roll with ya. We're my sisters, we got this, sisters. You roll with me and I'll roll with ya.
Sister ship, we got this now. Come on, let's talk about it. Sister ship, we got this now. Come on, let's talk about it. Sister ship, we got this now. Come on, let's talk about it. Sister ship, we got this now. Come on, let's talk about it.
Good afternoon and welcome to The Sister Ship. This is Deborah Kofer, aka Mama C, and on my left is
Tiffany Cole Bling, and we have a wonderful show for you today.
Absolutely. You know, for all of you guys who have been kind of toying with the idea of weight loss surgery? Well, we have a treat for you today. We have someone who's sharing information with us, Dr. Javier Birriel.
That's
okay,
right.
see, I was saying it wrong before, so he gave me the correct pronunciation today. So he is a bariatric, or AKA weight loss surgeon, and we're just gonna throw some questions out there, and we're gonna ask all of you that. Any of you who have questions, you can call us at start calling in at 3 p.m. And you can reach us at 888-304-4401. That's 888-304-4401. We want to hear what you're thinking about bariatric surgery and any questions we may not cover today. So welcome, Dr. Birriel.
Thank you. Thank you for having me.
Oh,
Excited about this.
That's okay. He is my doctor. So I mean, I fell in love with him as soon as we connected. I mean, the information and the connection. I think who your doctor is plays a large role in how comfortable you are communicating with your doctor. And let me tell you, we connected from the very moment. So I thank you for that, because I think going to the doctor in general is a scary thing for a lot of people. And when you start talking about bariatric surgery, weight loss surgery, there are people who really would like to do it, but there are a lot of myths and misnomers about weight loss surgery. So we want to kind of try and cover as many of the questions that they need to ask or information they need to know today. So I'm going to throw out a question to you. Number one. What is it that a person has to do to qualify for bariatric surgery? I know you have to be above a certain weight, or BMI has to be over a certain level, or whatever. Can you share some information about that?
Yeah, definitely. So the BMI is the body mass index, and a lot of times when you come into a doctor's office, they take your height and your weight, and that's something you can do at home as well. It's a calculation or a ratio of those two.
Right.
Come up with a BMI, and so the BMI is actually in about 5-point increments. It determines where you're at in terms of normal weight, overweight, obesity, and there's 3 classes of obesity.
Right.
Or the disease of obesity, and so that starts at 30. To qualify for surgery, even though that number is at 30, the insurance companies dictate what qualifies for surgery, and so that's 35, BMI of 35 to 40 with a serious comorbidity depending on your insurance.
Right.
So these comorbidities are diseases related to the obesity or medical diseases, which could be things like diabetes, high blood pressure, high cholesterol, sleep apnea, things like that. And then with the BMI of 40 and above, for the most part, patients would qualify by that BMI alone.
Oh, okay. Now, you just said that there are 3 levels of obesity. What are those 3 levels?
So the class 1, 2, and 3, okay. So it would be 35 to 40, 30 to 35, 35 to 40, and then really 40 and above.
Grossly obese is
right, you get
40
into the
and above?
Correct.
Okay,
right.
all right, okay.
Yep.
Now, what would you recommend people do before they start looking into having a surgery done? Do you recommend that they try and lose the weight on their own first before they start looking into surgery? What are some of the things that you recommend for people to do?
We definitely do. Even though I'm a surgeon, I love operating those sort of things, but I like to see everybody try and be able to do it on their own.
Right.
If we think that is achievable. Now, the one thing that is very difficult is as we age, especially our metabolism and things like that, and life gets in the way, we start to we start to have these yo-yo diets, is what we always say, and your body's set at this one point, and you're doing diet and exercise, you'll lose some weight, and we've seen people or individuals lose a lot of weight, and then it ends up, if you're not continuing that hard work, you can certainly bounce back, or even if you are continuing that hard work, you may hit a plateau and not get below that, and that's where surgery can step in, and especially as we take on more weight, we can also start to take on some of these extra diseases that I mentioned before, these comorbidities, and really the metabolic and bariatric surgery can help the treatment of those. But insurances, they definitely, depending on the ones, again, they definitely like to see some effort taken of the patient on their own before
Right.
getting to surgery.
Right. I think that, I did the gastric bypass surgery almost 20 years ago.
Yeah.
And my daughter has done the sleeve. So we both have had weight loss surgery. And I think that for most people, they don't understand that it's not a magic pill.
Right.
There is our responsibility to the process. It's actually, weight loss surgery is a tool to help us.
That's
Now,
it.
my daughter finally got to the point where she really bit the bullet and she changed her diet and she
Exercise.
right.
And did the work necessary to
Sure.
lose the weight. I actually started, like we talking about it, doing a green smoothie cleanse, and I also became a certified coach. So I had lost 40 pounds on my own before even looking into any type of surgery.
Yeah.
And my whole thing was, okay, I knew about the BMI, and after I lost the weight, I said, well, what other methods could I use to try and help other people lose weight, or tell them, okay, these are the tools that are out there that can help you. So I didn't think I would pass insurance-wise with having weight loss surgery, but I went in because I said, okay, I have insurance, so let me go see
if it can be done.
if it can be done.
Right.
And I went in, and by a margin,
thin
I
margin.
just passed.
Yeah, you
So I was like,
qualified.
you know what? Maybe this is because I'm supposed to be able to help other people understand the process and teach them what can be done to lose weight. So I went through the entire process of doing it, and I've been able to help a lot of other people who wanted to do the process but were afraid of it. But my thing is, you gotta learn how to eat first, because you will gain that weight back if you don't learn how to eat correctly.
Absolutely.
So usually if I coach someone first, I will tell them, let's learn how to eat first, and then I'll introduce you to a doctor if you are interested in weight loss, and then you go from there.
Absolutely.
But if you don't learn how to eat, you're going to eventually gain it back.
Oh, absolutely. When I started, when I got my surgery, I was 289 pounds. Even my doctor said, you know what, you look great for your weight. Some women just carry it well. And so I never had a problem with my weight. I dressed good. I looked good. I felt good.
Right.
It wasn't until my weight started affecting my health that I started thinking about doing something about it. And so I was 289. I went down, the lowest I went was 175. But even at 175, I looked really small. I have gone back up to like 230, and now I'm down to 212, and I'm working on it in terms of getting my weight. I'd like to be at about 155, 165. I think that would give me a little playing room, not overly playing, but a little playing room. And I think as we age, we really have to buckle down with respect to our health. And the weight in itself is an impediment to good health. And so, my father was diabetic. My mother was diabetic too, but she was diet controlled. She never went on any medication. My father had both legs amputated and died at age 50 in a diabetic coma. And I remember saying to myself, I'm not going out like that. And I'm 66 now, so I've already passed way past that 50 age, but I've come close to being a diabetic. I've been pre-diabetic a couple of times. So the last time I saw my doctor and I was at that pre-diabetic number, I decided, okay, it's time to buckle down and go back in the opposite direction. So I'm working on that now, and I think that the surgery itself still is helping me with that process, because I can't eat people eat big plates of food. Big plates of food, for years after surgery, made me nauseous. Even now, I eat on a little saucer or a cake plate. I never eat on a big food plate. And I think we have to find techniques to help us with respect to not only taking the excess weight off, but maintaining that loss, which is quite a job or a feat in itself.
Yeah. It takes a lot of work. Just like you said, this is just a tool. And so one of the big things I coach all of my patients on, especially preoperatively, is look.
Right.
This is it's a disease, so it's the disease of obesity, and individuals
Absolutely.
who are suffering with obesity, it's a lifelong disease. So even if you get surgery, you still need to put in the hard work
Absolutely.
forever. So
Forever. It's a lifelong.
Right.
It becomes a lifestyle.
right,
You know, you have to develop it. You have to develop the mentality that you now have to move into a different lifestyle with respect to your eating.
right. I mean, you have to relearn everything. Essentially, you relearn what you're doing. You do the smaller portions. You eat specific things. You make healthy choices. And that's a big thing. A lot of that ends up being education preoperatively, and then support postoperatively. So before and after, you need a lot of support throughout the way. Dietitians, social workers, the surgeons, the nurses, those sort of things.
Absolutely.
And PAs. So it takes a lot of hard work. It's a lifelong thing, but the dedication that gets individuals to surgery should be the dedication that you bought into for the rest of your life, right?
Oh,
Which
absolutely.
brings me to the next question. What are some of the medical tests that you need before you can have the surgery?
So it can vary by office or practice. In our practice, what we have individuals do before surgeries, we get some basic labs. We just want to tease out some basic labs. And even in those times, we've diagnosed some things with some diseases with patients, whether it's diabetes or thyroid disease, things like that. And so we
Right.
check all that ahead of time.
Right.
We also have them see a cardiologist, and the cardiologist will give us their risk for surgery.
Right. Right.
And so you'd have that, and if someone qualifies for a sleep study, meaning if they're at risk for sleep apnea, we'll send them for that or refer
Right.
them to sleep medicine.
Right.
And we also do an endoscopy, which is an EGD. Not every practice does that, but
Right,
we
right.
like to essentially look down into the stomach and the esophagus, make sure we don't have anything we need to plan for surgery.
Right.
Yeah, out of the ordinary, but and for the most part, after they do that, and then based off of their insurance, if they have to do monthly weight checks, which is essentially coming in on multiple or consecutive months and checking where their weight is, making sure they're moving the right direction. That's not
Right.
our requirement. That's the insurance's requirement, unfortunately.
Right.
But after they hit those check boxes, then we can talk about scheduling for surgery.
Oh, awesome. And what are some of the risks of this particular of weight loss surgery?
Yeah, so this is, we used to, bariatric surgery or metabolic surgery used to have a real big black eye on it from years ago when it was big open surgeries. And really the public image of that is sort of, or what's left over from that is that it's not something anybody should be doing. And that's why it's hard to bring up in a public discussion with, friends and family, those sort of things.
Right.
And we've come a long way from that. When laparoscopic surgery came on the scene, and then extra teaching, and then fellowships, which are an extra year of training after general surgery training.
Right.
When all these things came on board, now we've moved into a much safer era, and this surgery is actually safer than the two most common surgeries done around the world, which is getting your gallbladder out and getting your appendix out at this point. So it's
Wow,
very
okay.
safe. Most of the risks are less than 1% risk of occurring. These risks are the same risk as any abdominal surgery. Things like bleeding, infections, blood clots, things like that. The one
Right.
things we do talk about are leaks along any of the staple lines or any of the reconnections that we do.
Right.
That risk is less than 1% with this as well.
Oh, okay. Okay.
But so we've come a long way, and it is very, very safe nowadays.
Absolutely. And let me just talk about the risks I've had to deal with, the gastric stricture.
Yeah, the postoperative stuff.
Yeah, it's been almost 20 years, but I think one of the things that I didn't know, maybe they didn't even know at the time, is that ibuprofen is a no-no
Right.
for people who have gastric surgery, weight loss surgery. And I know I have a back condition called sciatica, and so when the sciatica would trigger and I'd be in excruciating pain, I popped ibuprofen in order to manage. It would seem to be the only thing that managed the pain.
Sure.
And so over-the-counter pain medications didn't really work that well unless it was ibuprofen. And generally, I took a stronger form. But now, knowing what I know now, after you and I met the first time, I should never have been on ibuprofen, a medication. I should never have taken it because it's probably what caused this gastric stricture. Now, will you explain to our audience what a gastric stricture is exactly? I think you could do that a lot better than me. I understand, but
You're on the right page. I mean, you remember a lot from the discussion, and what it is basically is the thought was that you developed an ulcer at that area. So this is a connection where with the gastric bypass, we connect the small gastric pouch, which can be about the size of an egg or about an ounce to 2 ounces. We connect that to the small intestine, a portion of the small intestine. So that connection or that anastomosis, you can get ulcers right there, and we call them marginal ulcers, right at that margin.
right.
And when things get so inflamed right there from an ulcer, it can essentially tighten down that opening and create a stricture or a stenosis right there. And so what you have to do is really calm that down and heal that ulcer, and then that area opens up again. That inflammation goes down. So a lot of the things some of the main things that can cause that are like you said, ibuprofen, so NSAIDs like that, things like naproxen, Aleve, steroids, these anti-inflammatories you have to kind of watch out for because they can decrease the blood flow to that area, just like nicotine or smoking, secondhand smoke.
Right.
You worry about that. You want to stay hydrated. And you want to minimize or decrease your caffeine use because that can essentially it may or may not lead to those things, but a lot of times those are inciting factors that can lead to it.
I'm working on the hydration thing. I mean, I know you told me I needed to increase it to about 64 ounces a day. I think I've gotten up to about 50, and some days it's a little under, but, I'm doing my best.
And drink water. As a matter of fact, my mask actually says
I saw that.
water. Yeah, I'm an advocate of drink water.
That's good. Yeah, same here.
My Facebook, I'm known for saying drink water, so I'm like, get your water in.
Absolutely.
My question is that the same for the sleeve? Because I mean, I was sleeved like 2 years ago, and then I had gained some weight back because I wasn't doing the right thing, and then I was like, you know what? Let me do what I'm supposed to do, and get back in track. So does that same thing happen for someone who's had the sleeve, or is that different from?
It's less of a risk, right?
Less of a risk.
It's less of a risk. You can get inflammation of your sleeve or your pouch there, but there's less of a risk with these things with sleeves versus gastric bypass.
So there's a lot of fear. I've heard, oh well, she cheated. She didn't do it the proper way. She took the easy way out, and there's really no easy way out.
No.
You got to work.
Right.
And
It's the hard way out.
it's the hard way out.
Right.
Uh-huh.
You really
It is
gotta
definitely
work.
the hard way out.
The first 40 pounds, like I said, I did on my own.
Mm-hmm.
And then again, I want to go into doing nutrition and helping other women to learn how to eat better and how to do green smoothies. And so I just went in that direction. And I do classes and help people learn how to make smoothies. It was just something I love to do. But a lot of people have that fear, and a lot of people don't want to say when they've had the surgery. And actually, I can tell now when someone has had the surgery.
Right.
And there's a difference because you can tell after you've had it done who's had it and who hasn't, and who's telling you,
Who's not messing up?
Right. There's a stigma.
There's a difference and there's a stigma.
Yeah.
And sometimes I tell people, figure out why you're doing it. Because if you're doing it because of health reasons or medical reasons, because some people have, diabetes, there's health reasons why you may need to get it done faster than how you're trying to take the weight off.
Right,
Mhm.
right.
And don't have that fear or that stigma. If you have insurance and your insurance is going to help you pay for it, why not look into it?
Absolutely, absolutely.
Because of the stigma?
A lot of times that ends up being what it is. Yeah. And
I
so,
understand.
and then individuals with some success, they are able to lose weight. I mean, you lost a lot of 40 pounds before you even decided to.
Right.
And we see things like that. And so it could be a fear. It's part of the stigma or the fear of the whole process because of that reputation that was before. And then it ends up being that, the general public, the population thinks that this is the easy way out or sort of a cop-out, but it's not. It's definitely the hard way out. You have to learn how to eat.
It really is.
Eat and drink and redo everything, and then it continues from then on. It's a lot of hard work leading up to it, and then afterwards as well. And This is by far
It's a
the hard
lifestyle
way out.
change.
It's a
Yeah.
total
Lifestyle
lifestyle change
And
you
I
have to commit to.
remember-
Right.
After I had the surgery, it was two of us that had went in, and they make you take give you get an evaluation to make sure that you're ready for it. Me and one young lady had went in, and then we went to see the doctor, and the lady actually cussed the doctor out because she wanted to have a cheeseburger,
Mm.
and you can't have a cheeseburger.
Right.
You know?
Right.
So there's a disconnect between your brain and your stomach. So you've got to like really train yourself. And I think I had to retrain myself how to eat. Remember to eat. You got to remember to eat breakfast, lunch, and dinner. And then you have to make sure that you're eating the right things, because after you can eat again, you can eat I can eat almost anything I want to eat. But it's what you eat that's going to make the difference.
Oh, absolutely.
Definitely. Yeah.
Absolutely. And I think that, we have to be realistic about the fact that, again, and I say this all the time, it's a tool that helps us. Like you have a screwdriver and you need to get that nail out of the wall, and the screwdriver is going to help you to get it out. You're not going to get it out without the screwdriver.
Right.
So you have to realize that screwdriver is a tool to help you get that out. Same as weight loss surgery. It's a tool that helps you to succeed with respect to weight loss.
Correct.
And a lot of people, again, they want a magic pill. It's not a magic pill. And like I said, I did gain some weight back. I gained about 40 pounds back. And I'm in the process of taking it off again. But now that my daughter has done the sleeve and she's committed to the lifestyle change, it encourages me, especially when she walks around and she's now a small, as opposed to she and I both were an extra large at one point.
Yeah.
And now she's a small, and I sit in my chair and I watch her walk across the room, and I'm like, okay, I can do this.
Definitely.
I can do this.
You,
I ordered some T-shirts the other day, and I ordered a medium, and the T-shirt came, it was too big.
Nice.
Wow.
Yeah.
See, those are all we call those non-scale victories.
Right.
That's what that is. Those are non-scale victories. I can.
Absolutely,
Yeah.
and it feels good, and I had to today the outfit I was going to wear today. I had some jean and a top, matching top, and I went to put the jeans on, and they were like extra snug. So I'm like, okay, I don't like anything squeezing me to death. So I put myself, okay, I'm going to put it back in the closet, because I know I'm heading back to where I was, because last summer I was down to like 194. So at 194, they fit perfect. At 212, I got a little issue. So I have to keep remembering, and I think it's important that periodically we try on our clothes, especially after we've done the surgery, to see where we are, because the clothes don't lie. Stay off the scale. People jump. They have the surgery, and next day they want to be 100 pounds lighter. It doesn't work that way.
Right. Absolutely, yeah. You can't do it every day. You need to figure out a good regimen for that. Going back to what you were saying about in terms of when individuals get surgery, when ahead of time, are you waiting till you have some of these comorbidities or these diseases, or are you trying to treat it? This is the whole goal of what we do, and why we call it metabolic and bariatric surgery, is because we get the weight loss, which is obviously a great benefit, and that actually helps drive our main purpose, which is to cure or treat some of these diseases that come with gaining the weight.
Absolutely.
We also have started calling it diabetes surgery, because this is actually it's better than medication for the treatment of diabetes.
It's almost a cure. Not a cure, but it's as close as you're going to get.
Right, and you can actually you can cure some individuals or put it into remission.
Right.
And actually has been looked at over years, and it's shown that it's substantial, and that it stays, the effect sticks around. So
that was my issue. I was on 800 metformin, and I didn't want to be on medication. I can't do it. So I said I need to figure out a way to
deal with
reverse
this
and deal with
right.
not having diabetes. And once you have it, we have a family history of it. How are you going to deal with it? I needed to deal with it from a weight perspective. So that's why I went into doing green smoothies, getting my weight under check, just dealing with it from a health perspective. And then just going further into the process and teaching other people how to do it. I've there's a couple of people that have helped get the surgery. There's other people who have done it just through green smoothies. Just checking in with me. Some of them call me the little doctor now. You know, I'm not a doctor.
The mini Dr. Matt now, yeah.
Because, you know, I could be a little tough sometimes. But
sometimes.
but it's real, you know, and we brought you on to talk about it because you do the surgery, you're a doctor, and you're experienced in it. And people are afraid of it, and then they're afraid to do the work.
Right,
Sure.
right.
So bringing on a doctor to maybe help with some of the fears and explain to people, you know, it's just a tube, but you got to do the work to get there.
Absolutely.
Is why we had you come on.
Right, yeah.
And I'm a big proponent of support groups. That's what I used to do. When I worked at the hospital, I designed wellness programs for women. And I did them in a support group fashion because I think when we can relate to one another and understand the challenges that we have and support each other through the process, it makes it so much better. You know, you don't feel like you're out there alone in the middle of this big old ocean of health challenges. You know?
Right. Yeah, and I mean, you two are support people or persons for each other. You know?
Oh, absolutely.
And, you know, we have a support group monthly. Most programs will have one. It used to be live, but now it's virtual with everything. And we usually have a speaker that comes on and gives talks. It depends on the topic of the month, you know.
Right. Can anyone go on and...
Anybody can go to the support group from our
I joined
practice.
it.
Yeah.
You
did. Good.
Yeah, I
good.
joined.
Is there a website that you can give us?
It's
Can you give it to me?
I have
I'll
all that
put it on?
information.
You do?
Yeah.
Okay, and I'll put it up. for
Yeah, we'll
everyone
put
in
it
the
up.
group.
Definitely.
They can
Definitely.
go on and join and.
It's a Facebook group.
Is it?
It's
Okay.
a Facebook
So
group.
we'll-
Yeah,
we'll
so
put it
I'll
up
give
so
you,
people
I don't
can-
have the exact name
And-
right now, but I'll get it when I get home, and because I always see the posts and I comment and, you know, so
Right.
forth. So,
And we want people to also call in today if you have questions for the doctor. It's 888-304-4401. We're going to continue on with the conversation. And also, we want to ask, is this a surgery that any procedure that, is the procedures reversible after you have them?
So in the rare instance that we would do it, it really depends on the patient and the patient's case. So the sleeve gastrectomy is not reversible because with the sleeve gastrectomy, what it is, we take the stomach that's about the size of you can say kind of like a football. We take it with a special sizer down to about the size of a banana. And so it becomes sort of a tubular structure, a banana-shaped stomach. That is not reversible because you're removing the rest of the stomach there.
okay.
The gastric bypass is reversible. And
So
that's
mine is reversible.
correct.
Okay.
It can be.
Oh, it can be.
It's rarely done. But,
I wouldn't want it reversed. I have to say that. As a matter of fact, you know, if I can get a redo, I would do that, you know. But you know what? I think at this particular point, my job is to do my part. You know, I already had the surgery. I don't know. I think my stomach is a little bigger than, you know, when I first had the surgery because one of the doctors said it's supposed to be the size of an egg, but right now it's the size of 12 eggs or something like that. So which means my stomach has stretched some.
The pouch,
But,
right?
yeah, the pouch has stretched. But, you know, I'm taking full responsibility to get my act together so that I can eat right. And I don't think portion control is my issue. I was, and I still am, but I'm controlling it. I am a carbaholic. Anything carb,
Yeah.
I'm, you know, and carbs, you know, from a diabetic perspective, convert to sugar.
Right.
So, you know, that's a no-no. So going on the keto has helped me to break that carb addiction to a certain amount. But like I said, last night I wanted a little something, and I had a half of a cinnamon raisin bagel with a little butter and cream cheese with some coffee. I didn't feel like eating a meal last night. So I had that. And my daughter wasn't home. I didn't think she was going to be in anytime soon, so I called myself. And then she walked in. I'm sitting there with it. I'm like, oops. I said, look, I just had to have a little something tonight, you know. I thought she was gone, you know, for a couple hours at least, you know. But, you know, I think that we have to be patient with ourselves in the process as well, because a lot of people, they get the surgery, and they want 100 pounds gone the next week.
Right.
So, I mean, what is the average weight loss with the surgery? You know, after surgery, what's the average weight loss somebody can expect if they're doing the right thing?
Right. Yeah. So it really varies by the patient's BMI or their weight.
Okay.
So especially what varies then is how quickly the weight comes off. Right. So
right.
for the most part, your body has a good endpoint or plateau point. We talk about excess weight for individuals, and when we discuss how much weight they've lost. So
Right.
excess weight, there's another calculation. We look at the male or female's height and calculate their ideal weight for that height.
Right.
And then all the weight above that is their excess weight. And so it can really vary by individual, but you know, the old statistics that are essentially some of the statistics that we like to quote are anywhere from 60 to 80% excess weight loss with the gastric bypass, or 50 to 70% excess weight loss with the sleeve. But a lot of times, you know, you see that those are big. You know, so that's a big spectrum there. But
Right.
you see individuals along those numbers for the most part after their surgeries.
Okay.
There is, you know, you want to do the hard work, hit that plateau, and then maintain that plateau as much as you can. You don't want to see the weight curve come back up.
So on my own, it was 40. Okay. And then May 23rd of 2018, I had the surgery. I had lost about 15 on my own and then started eating crazy and gained some back. And then I said, I'm not going to do this anymore, and I'm going to get right back on the right track. And then I lost 42. So altogether, I think it was about with the on my own, and then I lost 42 on my own. After COVID, I said, oh no, I'm not going to continue to gain weight. I'm not going to be one of those that sit home and gain the weight. I'm going to lose weight. And
she did. Everybody's like, okay, everybody else is gaining weight, and you're the only person we know that's losing weight.
Everywhere I go, they're like, we're gaining and you're losing. And I promised myself that I would not sit home and eat.
Yeah.
And I'm just going to control it. And that's what happened.
Nice work. Yeah.
Well, you know what?
Nice.
I think it's a mental thing where we really have to be ready, and we have to be determined that we're going to be victorious over this process, you know, that we're not just going to haphazardly do whatever we want to do, because the surgery doesn't come with a do whatever you want to do clause. Afterwards, the surgery is the tool. Afterwards, it's the work that we put in that ensures the success. Otherwise, you know, there are people who have had the weight loss surgery and gained all the weight back. You know, so, I mean, it is, you know, you got to deal with all components of what the challenges are. For some people, I'm an emotional eater. You know, also, you know, if I'm feeling, a lot of people are. If I'm feeling a little overly stressed or whatever, I don't know what goes on in my brain, but it's like, give me carbs. Give me carbs. And I'm like, oh, God, I'd be trying to fight it sometimes. It's like, give me carbs. So then it starts talking louder. You know, I'm getting to the point where I'm like, I will not. You know, I will not do that. You know, I have a goal. This is what my goal is. I want to be as healthy as possible. I want to spend my golden years mobile.
Right.
I don't want to be someone who's sitting in a wheelchair or confined to a bed or have died from a diabetic coma, which is what my father did, you know. So I think that it's so important that we realize we have to take full responsibility and then be accountable for what we do.
Right.
Because a lot of people go to the doctor and see they've gained a little weight. They don't want to be accountable for what they did, nor do they want to be responsible for the process. So responsibility and accountability are strategic when we're talking about weight loss surgery, you know? So
in the chat room, we have Joan, and Joan says, how long do you have to stay on a certain diet after surgery, Dr. Birriel?
So after surgery, usually what ends up, or every time, what we do is we put on a diet progression. So for about 4 to 6 weeks, the progression is starting with clear liquids to full liquids or things like shakes, and pureed food, then soft food, and then eventually regular food. So then the diet plan and the healthy choices is lifetime.
Oh, absolutely.
Right.
So it immediately after surgery, it's that progression, and then it's
It's up to you from there.
correct. And there's a lot of coaching that goes into these things, but you have to make the choice. So,
Absolutely. There's a lot of mental shifting that has to be done. You know,
Correct.
we got to flip the script. You know, they flip houses. We got to start flipping the script on our mind.
Can you talk about staying hydrated? Because I remember when I got out, it was like drink water, drink water, drink water.
Right,
Can
right.
you talk about that part? Because I remember that was really an important part of it. Can you talk about why?
It's important.
Definitely,
to,
yeah,
okay.
definitely. So and that's one of the things I coach my patients on. It's before surgery as well as after surgery. Is hey, look, the first month's going to be really difficult because
To get that water.
beforehand you could chug water when you were thirsty at certain intervals throughout the day, but now you can't do that.
can't
And so
do
the
that.
first month's difficult because there's some swelling at your connection or of your sleeve, or
Right.
even individuals that get some of these other surgeries we perform outside of those two. There's also some swelling there, so you have to take it slowly. You can accommodate only so much fluid per or food at a
Like 2
time.
ounces or something like that?
Right, you just start sipping. Really, we say right after surgery, hey, you should try to drink an ounce every 15 minutes.
Okay.
So that you go throughout the day and you work towards a goal of 64 ounces, right? So
Right.
anywhere 48 to 64 is really where you want to be, but you want to stay hydrated because if you get behind, you get dehydrated. You may feel sick, but you can't chug water at that point. So
Right.
Okay.
really, it's just a matter of doing the work initially, and then it gets easier to accommodate water throughout the day as you go on. But
Okay.
it's very important to stay hydrated because of those factors.
Absolutely. Can you talk a little bit about the dumping syndrome? Because that's what I thought I had when I ended up in the hospital, and that's when I learned I had a gastric stricture. I thought I was just, for some reason, going through the dumping syndrome. So can you talk about what the dumping syndrome is and possibly how to prevent it if possible?
Right. So dumping syndrome is something that happens for the most part after a gastric bypass, or even things like a duodenal switch or some of these other surgeries, as well as the sleeve less commonly. But after the gastric bypass, about 85% of individuals will have at least one episode, and that's as you're starting to learn how to eat through and what you can and can't eat, because
Right.
it's also a reinforcement. Dumping syndrome can be so. It ends up being if you've had a low blood sugar episode, so you may feel kind of shaking, chills, sweats, those sort of things. That in addition to maybe some diarrhea, maybe some nausea. These are episodes where your sugar does essentially fall.
Drop, yeah.
Right, it ends up being an insulin spike that can drive this afterwards because you consume, say, a sugary drink, a sugary meal, a high carb load, high fat load,
How
those
fat-
sort of things.
Right.
And it's an episode that goes away, but it ends up being a little bit more of a reinforcement. It ends up in that sense of, hey, I shouldn't have eaten that, or I shouldn't have
Right.
had this, that sort of thing. And then it resolves. So it can be pretty crummy how it can
It's
make
a
the
crummy
individual
feeling.
Yeah. So
Oh, it's a crummy feeling. Trust me, you don't want to have a dumping syndrome.
right,
You know,
and then it goes away, but it's not usually something that's chronic unless a lot of times the chronic issues, it's very rare for it not to have an inciting factor of the diet or something else, right? So it rarely happens, or less commonly with the sleeve gastrectomy patients as well,
Right.
and so forth. But it is something that can be, it's a common worry for patients.
How should a patient determine which process they should have? Because some people don't know if they should have a band, if they should have the
Right.
sleeve,
Gastric
if they should have
bypass,
the bypass.
sleeve.
Who determines that?
So really, I mean, I tell patients, hey, you're coming in, I want you to be as educated as possible.
Right.
Know your options, know what talk to individuals who've had it if you can. Talk to your support people, see really what you think is going to be a good fit for you. For the most part, the two surgeries that, the majority of the surgeries that we perform is going to be the sleeve gastrectomy and the gastric bypass
Okay.
in our practice. And so I have them sit down, we talk about their medical history, their surgical history, their social history, these things.
Excellent.
And then really I give my opinion on what surgery I recommend for them. So based off of their medical history,
Right.
I say, hey, you have this. Say if it's something, for example, if they have heartburn or reflux,
Okay.
that's not just diet induced. I'd say, hey, let's talk about doing the gastric bypass because your reflux can get worse after the sleeve gastrectomy. And say if someone has significant diabetes history, I talk about doing the gastric bypass is a little bit more powerful for of a diabetes surgery than the sleeve, but they
Right.
both are very powerful surgeries. Those sort of things. You really have to tailor it to the patient and the patient's history, and then I try to find out. You know, I don't try, but I find out what they would recommend for themselves or what they desire, and then we try to we find a happy medium.
Right, right. What about women in their childbearing years? How does this affect their ability to have children, or does it affect it?
It can, and so we have a lot of women that come to our services or to our practice that actually have what we call PCOS. PCOS can be a disease that comes on, especially with taking on weight. It can be cause a hormonal imbalance,
Right.
And can lead to infertility.
Okay.
And so that ends up being that patients, this is a great treatment for it, the weight loss.
Right.
And we have women a year or two out, they're able to then have get pregnant. And so it's pretty incredible.
Nice.
If it's, we try to tell women of childbearing age, hey, if you're looking to have kids, we want you to wait until about the 1.5, 2-year mark after surgery so you get to a healthy weight for yourself.
Okay.
And you're able to nourish yourself before you try to nourish a
A
pregnancy.
baby. Yeah.
Right.
Absolutely.
Also, the importance of seeing a nutritionist. I remember I always thought it wasn't important to see a nutritionist, but I now see my nutritionist like I see my doctor. And I believe that it's so important to have one. And until I started seeing one, it keeps me focused on what I'm supposed to be doing. I'm now no longer have a fatty liver. I was going to check on my liver like every 3 months or every 6 months. I can't remember what it was. And I was taking the necessary vitamins to help with my liver. And finally, I think I posted it on Facebook like 2 or 3 weeks ago that I
Right.
no longer had a fatty liver.
Fantastic.
Right.
Yeah.
Right.
And people don't understand how important the liver is to the whole process.
Yes.
Is that something that you can explain, or would that be something that the nutritionist would have to explain?
Well, the liver's a big deal, right? So
Yeah.
what an alarming fact is that we're moving to a point that fatty liver disease is going to become the number one cause for liver cirrhosis.
Yes.
Oh,
People
wow.
don't understand.
Yeah,
Wow. And
it's
you don't have to drink, right?
correct,
But-
right. It's so when we gain weight on the outside, we gain weight on the inside, and a lot of that weight or fat gets deposited in the liver or the solid organs. And so the liver can become very enlarged and then becomes inflamed because the fatty tissue actually can put you in a state of inflammation for the most part, and then these diseases present themselves.
Wow.
Well, the liver can get inflamed also, and so then it becomes non-alcoholic hepatitis.
Wow.
They call it NASH, so steatohepatitis, but that is the fatty liver disease then become inflamed and then become cirrhotic.
Wow.
And liver failure, and it's going to become the number one reason for individuals to need a liver transplant. Is from that over viral or hepatitis or alcohol.
So it is rising. That's rising.
Oh, absolutely,
Fatty liver.
absolutely. It's going to be the number one cause.
Wow.
I could be wrong. I think it was by 2030 they were predicting.
Do you recommend a vitamin that people can take? I mean, I have one that I do take, but do you recommend any kind of vitamin that people can take? Do you recommend
You
how
can talk
people-
about you can talk about omegas, things like that, omega 6s, omega
Right.
3s, those sort of things. But the biggest and best treatment for that is going to
weight
be the
loss.
weight loss.
Right. Right.
That's the absolute right there. That's the
Absolute-
kicker.
Absolutely. I mean, I know the last time I saw my primary care physician, my liver enzymes were up a little. And so he had me do, I guess, a CAT scan or MRI, or something like that. I forgot exactly what procedure I did. And I'm not quite sure where I am with that fatty liver thing at the moment. But that's when I learned, because when he said to me, my liver, I said, I don't drink like that.
Right.
That's when I learned that being overweight can also cause a fatty liver.
Right.
And so I think that people need to understand that being overweight can cause a myriad of health issues. Because like you said, when you gain weight on the outside, you also gain weight on the inside.
Correct.
And some of the excess weight does attach to other organs in your body,
Correct.
and creates a problem with respect to how they are supposed to be functioning.
Right.
So it's very important that people recognize that weight loss is essential. And I think that we live in a country now where almost everybody is obese. A lot of folks are obese.
Right. It's an epidemic.
It's an
That's what it is.
epidemic,
It's
yeah.
definitely an epidemic, and you're looking at over a third of American adults are considered obese at this point.
Wow.
Yeah. So, and that epidemic is actually why we lead into the fatty liver disease becoming the number one cause for liver failure. That goes right along with that. So, that along with some other things, including cancers. You know, there are a lot of cancers because that state of inflammation can drive some of these issues. That's just another topic of disease that can occur from this.
And I agree. I mean, we have to exercise. Don't get me wrong. If you ask me about exercise, I'm not the exercise person. I have an exercise bike. I exercise. I will walk. But I'm not an exercise person. But when it comes to eating and health and greens, that's me. I exercise. I will walk. I will get on my Peloton bike. But if you ask me about exercise, I'm going to direct you to the appropriate person when it comes to exercising. But you have to get your weight under control by the way you eat, because I'm a witness that the way you eat will control your diet first, and then you add that exercise in, and you got it.
Absolutely. It's the exercise is like the icing on
Right.
the cake.
What you put in is what you put into your body is about 80% of the battle, right? Or 80% of the driver for your weight loss. So
Right.
exercise is a big thing. Physical activity is what we like to say, and that is a big, great thing for your body overall to stay essentially optimized or conditioned.
Right.
But what you put in, what you're eating, that sort of thing, that's the majority of the pathway.
I had a conversation with my cousin Keisha Perez, and she's a correction officer, and she said, I've been exercising for 4 years, and I didn't start seeing the results until after I changed my diet. She looks amazing now.
Yeah.
We just had that conversation,
That's great.
I think 2 days ago. And she said, after I changed my diet, everything changed for me.
Yeah.
And she looks amazing. I think I posted a picture of her on Facebook, and I said, you know what, we're gonna have you come in and talk with Mama C on Zoom about that. And she looks amazing.
Absolutely. I mean, you have to just buckle down. At some point, you have to buckle down and decide that you're going to do this.
People are asking questions in the chat room. We also want people to call in at 1-888-304-4401, and you can talk
And
to
if
the
they'd like to
doctor.
start calling in now, they can.
I have Marcy. She's asking about the B12. I like to take the B12 shot. Usually, I get my B12 shot. They say you're supposed to do it weekly, but it's so far. My nutritionist is so far out. I take it when I go up there. What do you suggest in reference to the B12 shot? We also have someone in the chat room who, what was her question? Oh, is it recommended to do this surgery 2 and 3 times? What's your take on those 2 questions?
Okay, so the B12 is one thing. So there are a couple of different methods to get the B12, or to get B12, whether it's shots or by mouth, that sort of thing. Really, so what we have, and the good thing to do is really to follow up and get labs after bariatric surgery or weight loss surgery. These are labs that are going to check your vitamins and minerals, and really you'll get the levels off of that, and we can adjust, right? So sometimes, the B12 may be through the roof, and we need to cut back on the dosing, those sort of things. You may have some vitamin D deficiency or some of these other ones that your iron may be low, that kind of thing.
Right.
Where we make some tweaks or adjustments in the vitamins, because after surgery, you're on a multivitamin for life. They have special ones, the bariatric ones, or you try to get all of the components off of various ones if you like to go that way, versus the commercially branded ones. But really we want to check every year. So you get to about a year out from surgery, you want to be annually checked, get those labs in. So that can be from your practice or through your PCP. There's a certain panel that they can get. First year after surgery, we check those labs about 3 times.
Wow. I think that, when I got my surgery almost 20 years ago, that was like kind of the beginning of weight loss surgeries. And a lot of information we have now, we didn't have then. And so when I came to you, that's when I learned I should have been on a bariatric vitamin. I don't even know if they made bariatric vitamins back then. I'm sure they didn't. Exactly. No. Or some multivitamin. So I went to the vitamin shop and I got some bariatric vitamins. And then I learned that my iron is low. So the bariatric vitamin I need to be taking has to have at least 45 milligrams of iron. So that is something else I'm going to do. Let me just ask, because when I called the vitamin shop to find out if they had a bariatric vitamin that had 45 milligrams of iron, she said, no, we don't have that, but we do have iron up to like 90 milligrams or something. So is it recommended that you take 2 different things, or would it be more preferable that you get the 45 milligrams in a bariatric vitamin, or can it be separate? Because I'm like, okay, well, the one I'm taking, and this is the only one that they carry, only bariatric vitamin they carry, so maybe all I have to do now is get the 45 milligrams of iron to go along with that. Is that acceptable too?
On the side to supplement up
right,
to that?
To supplement.
Definitely.
Okay.
Definitely. Yeah,
okay.
you can definitely do that. And if it doesn't have what you need and what we recommend for those little tweaks, then definitely you can supplement with that.
Right, and also I got the nutritionist called me. You put me on vitamin D2, which is an not over the counter, but a prescription vitamin, which I'm taking also now.
Good.
So I think it's important for people to realize that with the surgery, we cannot take in all the vitamins and minerals we once were able to do. So we have to supplement whatever minerals and vitamins we need. And bariatric vitamin generally has 3 times the amount, so that it ensures that we are consuming enough of the vitamins and the minerals, etc., that we need. So I think that's very important. If you are someone who've had a weight loss surgery, you need to be on a supplement that will help you to get all of the nutrients that we need. Am I correct?
That's correct.
All right.
And a lot of times it ends, like say, for example, the gastric bypass, because of the way the anatomy is at that point,
right,
the food and everything you take in is actually bypassing or not going through that portion of your small intestine that would
right,
absorb a lot of those vitamins and minerals.
right.
And so the supplementation with the multivitamin is really what you need.
And is that the same with the sleeve? I think my daughter was told she needed to be on a bariatric. Is that also, or just primarily with the gastric bypass?
With both, but there's a more of a risk with the gastric bypass than with the sleeve, because the sleeve is still in that original anatomy, so it's
okay,
but the absorption may still be low.
But also know your numbers in general, because my vitamin D was low beforehand.
right.
So I was put on vitamin D
Two
way
also.
before,
Mhm.
which was not over the counter. My doctor
Prescribed
it for me, and I had to stay on it. My vitamin D now was like through the roof. So when I saw my nutritionist, it's like, oh, your number's the best I've ever seen in a while, because I stay on top of it. I'm always on my numbers. I'm like, okay, what's my numbers? I need to know what my numbers are. Just because now I'm like kind of conscious of what my numbers are, and being on top of it, just because I don't want to go on medication, and also because I have children who I don't want them to experience the same thing that I went through. So I'm always on them about their health.
Right.
Because they learn from our behaviors and what we
Correct.
do.
Right.
So now that I've changed my behavior, I see a change in them. But I also now have to retrain them, because I've installed in them my old behavior. So now I have to retrain them out of what I've trained them before.
Yeah.
So it's a little bit harder,
Mm-hmm.
but they're watching me. So my youngest one, she's a little health conscious, so she, eats it, and then they're gradually getting it. But I think, we all have to be conscious of what we're doing, because, like they say, your kids they follow you. What's that saying? That they do.
They do as you do, not as you say.
As you
Right.
say.
It's true. They do.
Right.
You can say
Exactly.
whatever you want to say all day, all night. They're watching us.
Right.
Yeah, you can't defend yourself.
Yeah, exactly. That is
Yeah.
so true.
My
Yeah.
biggest issue is, okay, I gotta change, because, I don't want them to go into this. And with the world being obese, somebody's got to change it.
Mm-hmm.
So, we're the first one.
Where
that
does
have
it
to change
begin?
Where does it
Exactly.
begin?
Yeah,
Exactly.
And it has
exactly.
to start at home. Like we said, everything that we do has to start at home.
Right, and they have a thing called the halo effect, which means essentially if as you start to go through this process, or anybody outside of this process, they take on healthy choices, and they start, whether it's lifestyle or what they're eating, that sort of thing.
Right.
The individuals or their family members or friends around them, the halo effect starts to affect them, meaning they start to do these same choices. They start to do healthier things,
Absolutely.
and their health starts to improve. So that's something that
Right.
is just goes hand in hand with that.
Oh,
Because
absolutely.
I tell one of my friends, don't tell me about that baby having diabetes. It starts with you.
Absolutely, absolutely. And we started some time ago getting rid of sodas and junk food and
Right.
juices with lots of sugar, and so that basically is the lifestyle we have in our home. We don't buy junk food to keep in there for the kids to eat and blah 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 blah. We try to get them in alignment with what the healthy behaviors need to be, so that they can begin now, and that they're not beginning at where we are. I'm 66 and I'm still trying to deal with this. I haven't mastered it yet. But for me, I've always said that whatever I need to do, I'm going to keep working at it until I master it. Not everybody is like that. Some people give up. I think that no matter where you are within the context of your life, and whatever it is you want, you got to keep working at it until you succeed. Sometimes I tell people life is a matter of science and mathematics. You got the science is the understanding, and then the mathematics. Okay, you develop a plan for yourself. Okay, variable 3 and 5 are not working. You subtract variable 3 and 5, and you add something else that may work. And then if that works, you multiply that behavior so that you're able to achieve the level of success that you want. Just because it doesn't work the way you planned or you want it doesn't mean it can't work. It means you have to change some variables in the process of what you're doing, and your goal, and so that it's in alignment with your goal to be successful.
Right.
So I think that that's something that people really need to understand. Sometimes I think we're like scientists on this planet. Our job is to experiment until we come up with solutions that are in alignment with what it is we're trying to achieve, particularly with health. Because I think people have just lost their minds when it comes to health. They eat whatever they want, and if you sit and you watch TV, some days I'm a couch potato. I'm good with that, because sometimes my mind needs to just take a break. So I'll watch it. Oh my God, the amount of food commercials, it killing me. You know what I'm saying? So I'm sitting there and I'm like, oh my God, But then I don't have to worry because ain't none of that in the house. And I'm not running out. It's not like when I lived in New York, you run downstairs and go to the corner bodega and you can get anything you want.
And get a chopped cheese. You can't do that.
Yeah, you can't do that, So I think living here gives us a level of discipline so that we can follow through with whatever it is we're trying to achieve, particularly when it comes to weight management and wellness across the board. Because there's just so much, and I think in the times that we're living with the pandemic, you got people who are trying to deal with weight obesity, and they're trying to deal with family issues, and now here comes the pandemic. People are just out of sorts right now. It's very difficult, What would you say should be the first step that people take with respect to getting their weight loss program in alignment with succeeding?
Before you answer that, you can call in now. The number to call in is 1-888-304-4401. If you have questions for the doctor, please call in at 1-888-304-4401. Joan, I see a question here. I'm going to read it off to him. I'm not quite sure that I understand it, but I'm going to read it off to him and see if he can answer it for you after this question. Go ahead. What was that?
Okay, the first step towards surgery, or
The first step toward, really, I think the first step might be getting your head together.
on any journey, exactly. Right.
Yeah.
It really is just reassessing, reevaluating things, and what's an easy way to do it. And our, the nutritionists always kind of preach or discuss this. Is
Right.
easiest thing to do is start a food log. If you log everything
Write
you're
it
doing
down.
throughout the day, then you take a look at it later. But if you honestly log it, right, and you're putting everything down on there, and essentially time of the day and what it was exactly, that can really hold you accountable. And you start to see, whoa, look, that's what I did yesterday, or that's what I've been doing. You can try to break some of your patterns. And things like you said, the sodas, cut that out. Just drink water, the juices, those sort of things, cut that out. Watch what you're eating. Make sure you read the labels. Check healthy options. Unfortunately, what ends up happening is a lot of the cheaper food that's accessible is unhealthy. And so that's something that it can be detrimental, and it can be a blockade to getting healthier for some individuals. And that's something that is, like you said, all over TV, all over all over the place. It's on billboards, etc.
Yeah, I'm going to tell you, I'm driving down 80. There's a Whopper
Big old
staring
cheeseburger.
me in the face, like, oh God, So I think it's really a matter of deciding that you want to live healthy as opposed to just eating whatever you want to eat.
Right, and it's very difficult. And like we said, it's a
is.
lifelong battle, and it really is trying to break those habits and trying to work your way towards the other side of things, but holding yourself accountable and making sure that you don't give in, which is very difficult.
Absolutely.
I'm glad that you said write it down, because I also do nails, and I had a client sitting in my chair, and she was asking me about the green smoothies. We were having a conversation, and I need to come and sit in your chair or sit in your office with the nutritionist, because I said, we were talking about it, and she says, well, I don't eat. So I did one of these. Gave her a look. I said, you don't eat? I said, really, you don't eat? So I gave her a look with the left eye. I said, you don't eat? I said, you want my doctor now? Do you want my doctor now? She said, what? And I gave her the doctor now. And I gave her a look. I said, you don't eat? And she said, no, I don't eat. I said, I need you to write it down. And I want you to write it down for an entire week. Because gave a look. You eating something.
Yeah.
And some people, they don't want it real. But I gave her a look. I said, you eating something.
You're eating something. Yeah.
So
Right.
You can't sit here and tell me that you're not eating.
Absolutely.
If you can sit here and tell me that you're not eating, and I'm looking at you with weight on you, you eating something.
You're eating something.
Right, and the thing is that we also see patients or people that say, hey, I don't eat breakfast. I maybe just have a snack here and there, and then I only eat really dinner's my only meal, so I'm not eating much the whole day. What that does is actually slows down your metabolism as well.
Exactly.
So eating a little bit in terms of small meals throughout the day, healthy
Right.
choices, those sort of things, it can keep your metabolism up throughout the day and actually help you and be beneficial
Absolutely.
towards some weight loss. But again, it just becomes getting that habit of healthier choices.
Right.
Absolutely.
It's hard work.
Now, what was it Joan
In the
wanted to
chat
ask?
room, Joan says, I think it was from a prior question that we had, but she said, so our blood test showing problems with the liver can lead to a doctor suggesting gastric surgery instead of another procedure? Does that make sense to you, or?
It can lead. I don't know what other procedure that you can do. Really, it's the weight loss that can help, right?
Right,
And looking
right.
at social history, also making sure no one's, that there's not a drinking history, these kind of things. But the weight loss is going to be very beneficial. You can improve or essentially heal the liver.
The liver, right.
After that,
Right.
And bariatric surgery or weight loss surgery is can be a great tool for that.
Right, right. Well, see, I've gotten on the nutritionist kick myself. So I saw the nutritionist on, I believe it was Friday. I had an appointment. And so I think that when you talk about accountability, responsibility and accountability are my two buzzwords these days, because a lot of people don't want to take responsibility and they don't want to be accountable. And I can understand that with everything going on. People they just want to be left alone. They don't want to do anything that's difficult or requires changing their whole mindset with respect to what they're doing. And I get that. But the reality is we have to. Mm-hmm. We just have to. If you want to live a healthy life and you get to a certain point in your life and you start seeing that your health is being affected by the weight, it's time to act then.
Not later.
Not later.
Now.
Like I said, when my weight started affecting my health, that's when I got the gastric bypass surgery. However, I didn't follow through. There was not the level of follow through and support then that there is now. So I decided that, okay, I'm going to see my nutritionist regularly. My next scheduled appointment with her is October 8th. I mean, because we have to do something that keeps us accountable. Because when we make ourselves accountable, we then become responsible to the process. You know, and I think that that's what a lot of people don't do.
Joan said you answered her question. Thank you.
Oh, good. You're welcome.
Yeah, just because you have a fatty liver doesn't mean you need gastric bypass surgery of any type or any weight loss surgery, but you do need to follow up with your primary care physician to make sure that that issue is resolved, because again, fatty liver can lead to cirrhosis of the liver.
Correct. Yeah, you want to make sure you get everything checked out. Any abnormalities, you want to get it checked out.
Right.
And really going back to what you said about waiting until you start to have problems, waiting until you get on medications, these sort of things. I tell, we say this on and on again, that what you want to do is be there earlier. So the earlier the better with this. If someone qualifies, if they're thinking about it, the sooner the better, the younger you are, the better, because we want this to be a preventative therapy from those diseases in the future, right?
Absolutely.
It can treat many of those things, but that's a tougher battle afterwards. What we want to do is even prevent those diseases from occurring.
Oh, absolutely.
Now, I know back when I did it, which was May 23rd of 2018, I had to use heparin. And I had to inject myself with heparin, I think, 3 times a day or something like that, or once a day. I don't remember what
in
it
the
was.
beginning.
Is that still something that has to be done, or has that procedure changed?
Yeah.
Go ahead.
Oh, no, so it varies by practice on the length of that. And what we currently do, so our sleeve gastrectomy patients, we put them on 2 weeks of Lovenox, which is another blood thinner, and that's a once-a-day injection. That is because what we've seen, not just us, but internationally, after sleeve gastrectomies, you can develop a blood clot that's deep inside the abdomen, and so that which can be pretty detrimental, obviously, for your health.
Right.
So what we do is we do 2 weeks of blood thinner for those individuals. Sometimes that could be a month of blood thinners, depending on the medical history of the patient, especially if they've had previous blood clots, those sort of things.
Right.
I remember that when I did it, I went home, and I was back to work in a week, I think for 3 days. The first day, 3 days, I was on the couch because I couldn't lay directly down. I felt better sitting up. They gave me a patch behind my ear. I think I wore the patch too long, so I lost vision for a minute. So I'm like, oh my God, I'm blind. And I called my doctor.
No,
drama.
Just take off the patch, right.
I called my
It just
doctor.
dilates your pupils,
Yeah,
right.
I called my doctor. I freaked out because I'm like, oh Lord, I'm blind. And they told me that I had to take the patch off. So what causes that? What?
There's an anti-nausea patch called scopolamine, and really it just it can lead to dry mouth. It just chemically it can do those sort of things, including dilate your eyes. Just like if you go to the eye doctor and you get an eye, they put drops in, your eyes get dilated. They say, don't drive or have somebody drive you, that kind of thing. So you get blurry, you take the patch off, then it gets better.
Yeah,
Okay.
I remember that. I had her driving me. I was like, oh my God, no, this is.
Yeah, because when she went, I stayed in the hospital with her that night, and then because she was going to come home the next day, and she had to go to West Bubble. Whatever, I'm not gonna say that, the rest of that, but she was like way out there. I'd have never found her again, I'd still be driving around looking for her. I mean, it was so way out there that it was like, oh my God, I'll never find my way back here. So I just spent the night, and then, she was fine, and I drove home the next day, and, so it is a journey and a process. And, when we realize that we need that level of help, to not get that help because you allow fear to take over, I think is one of the saddest things there is, because, I'm one of these people, fear has never stopped me from doing anything. I always tell people the only purpose for fear is to alert you when you're in danger. If you're not in danger, then your job is to understand what's going on. Understanding replaces fear, and that's what I'm hoping we're able to do today, is bring that level of understanding to the people who are watching today. And as this goes on into other social media sites, that more and more people will realize that there is an option and there is something that they can do to help themselves. You don't have to become 600 pounds.
We
go
will
ahead.
put Dr. Birriel's information up on our public Facebook group, and we will put his link up so that people can join his Facebook group as well. We have Gina Gilchrist in the chat room, and she said, for those who don't like pills, pill forms, is there anything else? Is there any other alternative? I'm not quite sure if she's asking.
With respect to vitamins,
maybe
she's talking about
vitamins.
vitamins.
Gina, are you talking about with respects to vitamins? Can you either call in now at 1-888-304-4401 so that you can explain that to us? Also, are you able to give us information on phentermine and dopamine? I know those are appetite suppressants as well. Some people, do that instead of the sleep. Like some nutritionists will give you dopamine and phentermine. I've had those before as well, and that's another kind of alternative that you can do before you even begin the process of bariatric surgery.
Sure.
Can you give some information on that?
Yeah, there are appetite suppressants. Those are great regimens too, but they are shown to help with some of the weight loss. Even some surgeons will put patients on, not in our practice, but will put patients on these medications beforehand to have them help lose some weight in the beginning,
Right.
kind of jumpstart things and on the way to surgery. So our medical weight management side, our bariatrician, our medical weight loss specialist, some individuals that are in our medical weight management program, they are on medications such as these, and I know that some PCPs do set up these practices and do prescribe for their patients these things, and they can be helpful. But it doesn't give you the sustained, impactful weight loss that you would have in the long run after surgery. But it can be helpful, and that is for certain individuals. That the one thing that you have to be careful of, especially the prescriber, are the contraindications or the how it mixes with their other medications.
If they're on other medications.
Correct.
Okay.
Chemically. So there are different, just not that combination. There's that combination. There are some other ones that are options.
My oldest daughter is conscious about her weight now, and I actually have her seeing a nutritionist. And she's not going to go through any surgery or anything right now because she's young, and she needs to learn how to eat. And she needs to, again, learn how to eat, control her weight, do other things first, because again, if you don't know how to control your weight, don't bother. So she's seeing a nutritionist now, and they kind of gave her the appetite suppressants, and I said, yes, let's start you with this first. Let's see how you do, control how you eat, and also she doesn't like green smoothies, so we fight about that, but she's learning how to eat. She's still a little hard on herself with keto. She doesn't know how to do that. So I said, you just have to find what works for you, because what works for me may not work for you.
Absolutely.
So I also have a group where, I tell people what works for me may not work for you. Do what works for you, but find something that works.
Yep.
Find a support group. Find something. For me, it was posting every day. Posting in a group once a day, just to help me remember and stay conscious. And I started posting in the group, and now I said, okay, my accountability, because I can't keep posting in this group, and I'm not losing no weight, because now they're gonna say, okay, well, she's doing it, and she ain't losing no weight. So it was my accountability where I couldn't be talking about it and not walking the walk.
Right.
So I had to do it.
Right.
So my accountability for me was to continue to post in my group, which is called Our Health Matters. And I continuously just started to do that.
Right.
And eventually I was like, okay, you can't talk the talk and not walk the walk.
Absolutely.
Good.
And you
yeah.
gotta find ways to make yourself do what you need to do. So again, it may not work for me, for you, but it works for me. But find a way that works for you so that you get it done. Gina said, can supplements be mixed in a smoothie? Gina, you're in the group with me. Absolutely. We use collagen. I mean, I can answer that.
Yeah, I put collagen. I
We
use collagen in my coffee in the mornings. I add the collagen
Sure.
and my heavy cream because I'm not doing the carbs, which means my caramel macchiato creamer is out because it's heavily laced with sugar.
Right.
So
Right.
What supplements do you recommend?
Supplements, really, some of these supplements are good, right? And they are helpful. The main thing and what I can only really recommend are going to be these multivitamins and making sure that you are getting all the supplements that you need for your overall health and nutrition, vitamins and minerals.
Right.
That's going to be the big thing. And I know maybe earlier when we were discussing if it's going to be pills, you can mix some of these things into your drinks, but they also make what's kind of like a Keurig form of a multivitamin. Some patients
really?
get it's a certain type of machine that can pour you out about an ounce or so. You just drink it once a
Where did you
day.
get that from?
Well, yeah, that's
I can't ever
interesting.
remember the name. I
Okay,
know.
okay.
There
Is
is
that in
one
your
thing.
group?
No.
No.
It's commercially. It's something you can
I
buy
think
off the
I've seen
internet.
it's like a Keurig that now you're gonna make me go hunting. Cause
Yeah,
Oh,
just
yeah.
I'm sure you can
I'm a
Google
gadget
Keurig
person.
multivitamin.
She's a gadget
Right.
person.
Now I gotta find
oh
this
my
thing.
God! One more gadget in our house.
Right.
I have to move out. Won't be no room for me.
Now I gotta find this thing.
Yeah, I mean, there's that. There's also patches. Some patients like to do, but that's a daily patch, so sometimes that can be a little bit wasteful. But daily patches. There's also there are also the gummies, which can have.
lot
They're
of
like
sugar.
they're like Starburst.
Yeah,
No, they're not
gummies,
full of sugars, but they're helpful. Not the like the gummy bear ones.
Mm-hmm.
Those we recommend against because a lot of times they don't get broken down fully and then absorbed.
Oh, okay.
But the gummy ones that are like Starburst type materials, those are okay also.
I know. Recently, I started taking. My daughter and I are taking Goli, which is a form of apple cider vinegar, but it comes in the form of a gummy, but not a
Okay.
bear. Like it's very chewable, very soluble.
Yeah. Chewable's what I
Yeah.
should call that other one. But
Yeah. So I do that every morning before I.
Oh, we have a call.
All right, we have a
I
call.
also have Marcy Robinowitz in the room. She says that she's
Good afternoon, caller. Who's calling?
Hi, this is Joan. How are you?
Hi, fine, Joan. How are you doing?
I'm doing well, thank you.
Okay.
I just wanted to call and say I don't have the doctor's name, so I'm sorry I can't call him by name.
That's
Dr.
okay.
Birriel.
Dr. Birriel.
Okay. I think this was a very interesting subject, and I wish a lot more people were on because I am ignorant to the fact, and I've had friends that have had it done, and I didn't know a lot of this.
Excellent.
And that's why we wanted to do this segment today. Like I said, I did the gastric bypass almost 20 years ago. My daughter has done the sleeve
2 years ago.
2 years ago. And, there were things that when I did the surgery, I didn't know. And that's one of the reasons I ended up with this gastric stricture and then have a clue that this was a possibility later on down the line. So I think we're constantly evolving and learning new things. So we wanted to bring this topic to our audience because there are a number of people there are a lot of myths and misnomers about the weight loss surgery, and there are a lot of people who need it. So we are hoping that today this will clear up a lot of the questions people have.
And also, I think we wanted to bring it to you because I heard a lot of people
I
going.
have two questions that.
Go ahead, Joan. Hello? Did we lose you?
I think we lost Joan.
I think we lost Joan.
Call back.
Okay, call back, Joan. I think we lost you. Okay.
Until she calls back, we have Marcy in the room, and she said, I know Marcy, she's my Jewish mom. I call her my Jewish mom. She's also had the surgery as well.
Yeah, she did.
And she says that she's always cold, and she was advised to have the B12 shot every month. Is the B12 shot something that helps with being cold, or do you recommend something for that when you've had the surgery?
That can be something that comes on after surgery. That's a common complaint of being cold. I would say if that's the recommendation they're giving, I would get the levels checked, not just give B12 because she's cold. That's not, it's probably not a great answer for her, but that's the one thing I would suggest is I would not just blindly give supplements as a thing, right?
Right. So they need to check with their primary care physician and have that physician keep checking on their numbers so that they're aware of where they are.
To make the adjustments, right.
Good afternoon, caller. This is Mama C. Who's calling?
Hey, Mama C, it's Joan calling.
Okay, Joan. Okay, all right.
One of my questions was, how often can a person have this done to their body?
Like you're saying, if, like me, I had it 20 years ago, can I have it again? Or is it advisable that I have it again if I need to reduce the size of my stomach again?
Right. So.
Okay, and you said Tiffany had the sleeve.
Right.
Is that something that is inserted into the body?
No. Your stomach is removed.
Yeah.
Doctor answer you.
Right, so the sleeve gastrectomy, the stomach is actually, we have a special sizer, and then what we do is we resect the excess stomach along that, and so the stomach is reduced in size down to about the size of a banana. And then going back to your first question in terms of what we call those are revision surgeries.
Revisions.
So the first surgery is a primary surgery, and then afterwards a revision. It's not recommended. So there are some patients that come back and say, hey, I've had some weight gain. Can we get another surgery? The thing that comes up with that is if we convert you to a different surgery or we do the revision, it's hard to predict the success of that with weight loss afterwards because you lost a significant amount with the first surgery, and then the expectation many times may be I'm going to lose that weight again the same fashion after the next surgery, and that's not the case. So a lot of the times what we do, especially in our program, the protocol or the pathway for revision is 3 months of medical weight management beforehand. We try to make sure that we're back on the horse, we're back on the wagon and on track with what we're supposed to be doing with healthy choices and lifestyle, and then work towards that. And there are many times where the patient may go through that medical weight management process and then decide I don't need surgery. I'm going to stick to what I'm doing here because it's working.
It's working, exactly.
Right. Going back to what I was doing before when this all started, the revision surgeries that may occur or that may actually be very beneficial is if a patient's having issues. So, say if
like
a patient,
the gastric stricture.
Correct, exactly, yeah. If that couldn't get resolved or it was multiple occurring times and that just kind of a cycle, then we talk about doing a procedure kind of shrink down the pouch size a little bit.
Okay.
Sometimes after the sleeve gastrectomy or the band, if an individual's having issues with swallowing, reflux, heartburn, or multiple other things, then we can talk about converting that or doing some procedure to try to achieve a good outcome for them.
Oh, okay. All right.
Well, this was very interesting. I really liked it. And
Thank you.
Thank you so much, Joan.
Thank you so much, y'all. Have a great day.
All right,
Thank
you
you.
as well.
Take care.
All right,
All right.
bye-bye.
I have to say that one of my reasons for us doing the show and bringing this to the show was a lot of the rumors that came about was and that we heard out there was, oh, she's training people on how to do green smoothies and she cheated herself. Well, no. I went into doing the green smoothies in order to train people and teach people that there are different ways and different methods of how to do it. There's so many tools out there that you can utilize.
Absolutely.
And helping women and men and people just do the right thing to be healthy.
And to find out what works for them.
And what works for
Right.
them. And what gets my goat is when people don't understand and take the knowledge and understand what to do to help themselves.
Right. Well, a
So
lot of people don't want to
that-
help themselves,
right.
so that
Exactly.
you have to understand too. Again, they want the magic pill, don't we all?
There is no
Right.
I want the
Right.
magic pill for weight loss. I want the magic pill for making money.
And whatever
You know?
procedure you choose to do, there's no magic pill.
Absolutely.
You have to put in the work to do it.
I think
Yeah.
that is
Right.
such an important realization that people have to firmly embed into their minds because it is a process. Weight loss, whether you get weight loss surgery or you do it some other means, through some other means, it's a process, but you have to figure out what works for you. Because again, I think like Tiffany said, what works for her may not work for me or whatever, I mean,
But know what's out there.
but know your options, be willing to experiment and try different
Yeah.
things so that you can kind of figure out, okay, if I get the surgery, I know that if I drink green smoothies once a month, do a green smoothie cleanse or whatever, then I can handle this. Or, maybe keto. Maybe I need to do a form of keto or whatever. But on that note, this has been a great show. Thank you so much
Oh,
for
my
being
pleasure.
with
Thank
us.
you.
I'm getting the circle that, okay, let's wrap this up. So, I'm being obedient here. But thank you, Dr. Birriel.
My pleasure.
I know I have an appointment with you next month as well, and I'd like to I'll probably see you before I see my primary care physician, so I need to follow up and find out where this fatty liver thing is with me, so I know what I need to do and get with the program. So on that note, thank you for being with us, and thank you everyone who was in the chat room, who tuned in. Thank you, Terry, for being our ever faithful engineer and making things happen for us.
Terry's actually going in for the Nick Chuck, as he calls it. He's going in for the Nick Chuck next Monday. Okay, so I have convinced Mr. Terry Pickering to do the Nick Chuck. So we have been going through that procedure for the last couple of months, and his surgery date is actually coming up. I'm talking about Terry Pickering, but
we've got to do what we have to do.
Decisions that are best for you.
Absolutely.
There are a couple of people that I've walked through the procedure, and it changes your life.
It changes your life for the better.
There are some people who just did the green smoothies, and that worked for them. And there are some people who just did the appetite
Just did
suppressants,
ketos.
and there are some people who just did keto. Like I said, do what works for you, but make sure that your health is in order.
Absolutely. And on that note, bye everyone. We'll see you
on the
again
Sister
next Sunday, same time, same place, right here at GenesisRadio.com.
Thank you.
Thank you so
Yeah,
much.
I had a great time.
Absolutely.
It's fantastic.
Oh, it was one.
Yeah, we on a sister shit. Come with us, we on a sister shit. Yeah, we on a sister shit. Roll with us, we on a sister shit.
Sistership, we got this now. Come on, let's talk about it. Sistership, we got this now. Come on, let's talk about it. Sistership, we got this now. Come on, let's talk about it. Sistership, we got this now. Come on, let's talk about it.
We're my sisters, we got this, sisters. You roll with me and I'll roll with ya. We're my sisters, we got this, sisters. You roll with me and I'll roll with ya.
Substance, sis, you know we on a mission, no games. Help each other get over some things, build strength, bring change. Cause we've been through the rain, now it's time to shine like bling. Let's talk about life skills. We building up our quality to right wills. We rolling out of poverty, love heals. So we become the prodigy of how a sistership could be a really hot commodity. Stand together, we united, hold hands. Support each other dreams and our plans, doing everything we can. Just to show we understand the power of a friendship, fam. Live life on purpose, together we learn it. Yeah, let's talk, we don't wanna see you hurt. And we here for each other, no matter the color, networking. That's for sure and for certain. Come on. Yeah, we on a sistership.